Hey everybody, thanks for tuning in to MRPA's Lunch and Learn series. Today we're going to be focusing on sharing our creative ideas, specifically speaking about internal initiatives across the state. This intro is being recorded after the fact. We actually had some technical difficulties on the day of recording when the session went live, so we did lose about the first few minutes of the live content itself. That being said, I'm going to start out with a quick intro, and then a transition will take you into our presentation that was previously recorded about mid-stride. But don't worry, you only missed a couple minutes at the beginning, and there's still a lot of great content that we captured. So without further ado, I'm going to go ahead and start. In our first town hall session, we focused on some of the creative ways that local agencies have been hard at work to keep the connection going between them and the communities that they serve. This time around, we'll be sharing some more creative ideas, but with a different focus. We'll look at some of the ways that our industry, on a local level, has been making internal changes. We'll talk about sanitation efforts, health and wellness initiatives, and some interesting new ways to track data related to our COVID-19 response. On today's session, we're going to have a panel consisting of the following members. We'll have Joanne Barr, who's the director for the City of Laurel Department of Parks and Recreation, followed by Cynthia Henderson, the HR principal, and AmberLace Moore, the corporate wellness coordinator for the M-NCPPC Health and Benefits Office. And for those of you who don't know, that's the Maryland National Capital Park and Planning Commission. They're responsible for the administration of parks and recreation and planning services for Montgomery and Prince George's counties. After Cynthia and AmberLace are done presenting, we'll transition to the Montgomery County Department of Parks EAM and GIS team. That consists of Hassan Symes, the EAM and GIS manager, Christopher Brens, who's a data analyst, and Carter Hughes, who's a GIS specialist.
Where else could we purchase supplies from other than our typical custodial vendors? So if you go to the next slide, you'll see that we just created our own solution. I'm sure many of you all have done the same thing, but we did want to ensure that we were labeling our bottles. We were ensuring that we were using the appropriate amounts of bleach to water solution, excuse me, in order to ensure that people were safe in using, in using the bleach and water. Our custodians would make the mixture up in the big orange coolers that we had plenty of, that we use for all of our recreation activities, and they would be responsible for filling the bottles throughout the week. We would change the solution every several days so that it was remaining fresh, and this became our Clorox pop-up alternative. Then we started thinking outside the box, said, well, what else did we have available to us? Well, we run a couple of concession stands, and we were at a food show that happened to be right before we shut down, and we recalled using the surface sanitizing system for cleaning your restaurant. That's used in restaurants. We use this to clean our concession stand. Same type of system that you would see with a Clorox bleach wipe. So we had the buckets, and we just needed to get the refill supplies to put inside the buckets, and it acted just like the Clorox bleach. So, it was a great way. We used, instead of nitrile gloves, we were able to use the less expensive food service gloves. Instead of using bleach and water solution on our keyboards, we went to our first aid supplier, and we got plenty of alcohol preps and a much more economical and accessible way of operating. So next we had to look at what were we going to do when we sent people home, creating an equitable work situation when some people still had to stay on the clock, still had to be in working, and others were able to go home. So the next slide. So like everyone else, we just looked at creative scheduling. First, we needed to determine priority tasks. Obviously, like everybody, they were our grass cutting. That wasn't something that we could let go. It was the beginning of March, and just like everybody else, that's your prime time for starting your grass mowing. As well, we still had to have our custodial services working in buildings that were still open. Our Emergency Operations Center at City Hall was open, our DPW, our police department were all opening, and we still needed to have custodial services. We did have some individuals who were high risk, so they were already sent home. So we had to take a look at what we had available to us, and we, like a lot of other agencies, we created the 2 or 3 man crew. For us, we worked in a 1 week on, 1 week off schedule. This also allowed us, if anybody did have to quarantine, they could use the 1 week off and then couple that with another week. And if they were able to come back, it was easier for us to just fill their shift for 1 week rather than them going down for 2 weeks at a time. We pretty much came up with your day is over when your tasks are done. Creating the task for the day, whether it's what your mow schedule was going to be or what areas needed to be cleaned. As soon as you finished those tasks for the day, you were free to go home. And then ensuring a safe work environment, making sure that we assigned plenty of PPEs. We had masks on hand. We had plenty of gloves and cleaning solution, and ensuring that we got that out to the staff to keep in the vehicles. Each of our parks crew already had their own vehicle assigned to them, but we didn't want to share any other type of equipment. So all of the equipment that they would need, they would put into their vehicle, and then they would sanitize it at the end of the week, and it would be ready to go for the next crew. And then allowing or creating situations where people worked independently. We didn't send out any more than 1 individual to any one work site. We started their schedule earlier in the morning, really to limit their exposure to anybody else. Go to the next slide. So I guess, in conclusion, really the most important aspect of making all of these things work for us was communication. We had to have a way of communicating with our staff, especially those who didn't have access to some of the same technology. We didn't have Zoom meetings or GoToMeetings, but we had to have a way of communicating with them. So we started using parking lot meetings. The staff would meet in our municipal center parking lot. They'd remain in their vehicles. And it was really an opportunity for our mayor and our city administrator and supervisors to communicate with our staff as to what was going on, what were the city's plans, where were we in our COVID plan, and then getting feedback from them to find out, did they feel that we were keeping them safe? Did they feel that the schedule was equitable? And what problems did we have? We were very fortunate that no one was sick. We made it through, hopefully, the worst of this, and where everybody is happy to be returning. The biggest concerns were ensuring that they had a job to come back to, and we are very happy that they stayed and they did what needed to be done, and they were all happy to return, and we're definitely happy to have them all back. And we're like everybody else, and we're moving forward and going to institute some of these same measures when we do open up again. So luckily, the work was done on the front end, and it should be pretty easy to move forward from here. So thank you, and I wish everybody luck with moving back into their regular operations.
Thank you, Joanne. So we've been looking at the chat room over here. We'll encourage anybody that has questions for Joanne to post them in there. For the sake of time, so I don't see questions popping up just yet, we're going to transition into our next presenter. So we're going to go ahead and toss it over to AmberLace Moore with the Health and Wellness Office with M-NCPPC.
Thank you. Hello, my name is AmberLace Moore. I am the Corporate Wellness Coordinator for M-NCPPC. I will discuss a few ways that I have used to help keep our employees engaged and connected due to the many changes in our lives and ways to cope during and after COVID-19. Next slide, please. First, I will begin by speaking about the importance of well-being and how your well-being may have been or may be impacted by COVID-19. Next. This chart or pyramid depicts the overall 9 dimensions of wellness that the Workplace Wellness Program focuses on each year. During a crisis or traumatic event, one dimension is impacted or affected. It can impact and affect other areas, causing a domino effect. Areas of wellness that I have specifically focused on during COVID-19 includes financial wellness, emotional or mental wellness, physical wellness, and occupational wellness. These 4 areas have either been directly impacted or subsequently impacted by COVID-19 the most. SHRM, the Society of Human Resource Management, posted an article about the financial stress is being aggravated by COVID-19 and directly linked to physical wellness. This article also mentioned the importance of educating employees about the Family First Coronavirus Response Act, which was signed into law March 18th. Finances were already the #1 stress concern in America and the world before COVID-19. Now it has spiked, unfortunately. Individuals have experienced changes in loss in job, loss of reduction in income, stressing about how to make ends meet, which can lead to a lack of sleep, worry, anxiety, feeling isolated, fear, or even experiencing the quarantine 15. But in situations like this, it is important for us to all thrive despite what we are going through. Look on the positive side and find a silver lining in your situation. For some, it has been spending much needed time with family, gaining a greater appreciation for our teachers, daycare providers, and camp programs since the kids are with us 24/7 now, finishing up at-home projects, starting new hobbies, waking up and not having to get in your car to sit in traffic. And for those that are still going into work or the office, we thank you. I can imagine pollution rates have decreased, and there are beneficial changes happening to our environment. This is one major way to cope. Ask yourself, what are you grateful for? And look on the bright side. There's always one. And if you have a hard time with doing that, no worries. There are resources I will mention in later slides that can help you. Additional internal and external resources include your employer's assistance program, retirement program providers, life insurance program provider, and legal program providers. External resources that I have used that are reputable include shrm.org, mymoney.gov, moneymanagement.org, and consumerfinance.gov. Next slide, please. The following slides will include resources that I have shared with M-NCPPC employees to help in coping and thriving through COVID-19. Next slide. Apps. Don't we love them? The food apps and the phone apps. I love them both. Zenvallow is the #1 app for stress and depression with over 3 million users. Zenvallow is offering free premium access through COVID-19 crisis. Zenvallow offers self-care prompts and resources, peer support, coaching, and therapy. You can speak to a licensed clinician remotely with live video sessions on your phone, tablet, laptop, or desktop. Zenvallow Therapy gives you the support and flexibility you need. Another app is called Talkspace. It is the #1 rated app for online therapy. With Talkspace, you can send your licensed therapist a message whenever you're near a laptop, tablet, or smartphone. Talkspace has banking and grade encryption to keep conversations safe and confidential. Currently, they're running a special for $65 off using the code APPLY65. Another app pictured is called the My Strength app. It offers evidence-based self-help resources for mental health and overall well-being. They have interactive modules to address the most common behavioral health issues, including anxiety, chronic pain, depression, insomnia, relationships, and stress. And also on the slide is the Calm app. It is an app that helps you stress less by focusing on sleep health. I also wanted to mention that you should check with your healthcare provider and EAP provider because some of these or similar apps may already come with your plan. But at this time, I do know the Zenvallow app is free to everyone. Next. In the beginning of the year, our company gained a new partner called Burn Along. I realized that with many locations that we have, it is nearly impossible to engage multiple people in the session at so many locations. Therefore, I looked into Burn Along. Burn Along is an online health and wellness platform that features hundreds of classes in over 40 categories, from prenatal care to healthy sleeping and more. And if they do not have a category, they will literally create one for you, such as the newest one. Due to the COVID-19 crisis, Burn Along launched a series directly related to how to cope with COVID-19, which focuses on topics such as speaking to physical, mental, emotional wellness for all ages. This platform is great because I can recommend sessions, send an invitation for colleagues to join a session with me, or they can browse and watch sessions on their own. Next. The usage of virtual platforms for engagement and connection. I am pretty sure we can all consider ourselves pros at some virtual platform or another, whether it be Teams, WebEx, GoToMeeting, or some of the others. Typically each year we have an in-person fitness week in May for National Health and Wellness Month, but due to COVID-19, of course, that was canceled. So I took advantage of every virtual platform that I could. By reaching out to our fitness vendors, wellness champions, and fitness and nutrition employee volunteers, I hosted a virtual fitness week with over 30 live sessions, which resulted in high engagement from our employees. This is something that you can do for your employees any time of the year, even when we return to the offices, whenever that will be. Employees have had such a great time joining in on fitness sessions and info sessions to gain information, taking a break from the day, seeing coworkers, and partaking in a fun workout. It literally felt like a work reunion. Next. Another resource that is beyond amazing is our Employee Assistance Program and Wellness Portal. EAPs have such great resources on a regular basis, and during COVID-19, they really provided a robust amount of information and resources for employees on ways to cope and simply reduce stress. One way to cope with COVID-19 is to simply stop mentioning it. Just focus on your health and well-being. Stop being reminded by what we hear and see on the news every day. Do not live in fear about COVID-19, yet stay smart and cautious. It is okay to feel anxious, but do not let it take over your mind. Chat with someone, get it out, journal, draw, walk, laugh, even watch some TikToks. This slide here shows 10 tips to relax and reduce stress. And this is something I've needed even before COVID-19. EAPs may also do more than provide resources on the employee portal, but they may also host webinars, have financial information, counseling, help with work-life situations, and even legal support and resources. It is a great idea to reach out to your EAP provider for specific information on your employer's program. Next. Thank you. Finally, external resources. Of course, we know the World Wide Web has endless resources. I have stayed consistent in using a few reputable ones to help cope with the new changes in our lives. These include the American Heart Association, the World Health Organization, the Centers for Disease Control, and Mental Health America. I love when I do not have to reinvent the wheel and when the idea I had in my head just comes to life by going to one of these websites. The resources pictured are directly from the website, and there are many more simply yet very helpful reminders for employees ready for sharing, posting, and hashtagging. In summary, and if you would like, you should get a piece of paper and a pencil so you could jot this down. These are the coping resources that I mentioned. So in summary, things you can do is analyze your well-being, engage in self-care, focus on gratitude, tap into holistic care. Ask yourself, are my chakras aligned? What are chakras? How is my energy? Maybe try diffusing some essential oils. Sage your home of negative energy and worry. Meditate. Use virtual platforms to connect and engage with employees and coworkers. Eat healthier, cook more. Utilize EAP resources and company partners. Mobile apps are out there. Use and refer to reputable websites. And of course, check out your employer's workplace wellness program. Next slide. Thank you.
All right, thank you, AmberLace. I think at this point we transition over into Cynthia's portion of the presentation, and after Cynthia wraps up, if anybody has questions for AmberLace or Cynthia, feel free to put them in the chat room for us.
Good afternoon. Again, I'm Cynthia Henderson, HR Principal, M-NCPPC. I will review measures adopted by M-NCPPC's health and welfare vendors to step up to the plate and respond to COVID-19. Next slide, please. I'll begin with our medical providers, United Healthcare and Kaiser Permanente, focusing on three aspects: telehealth, members' costs for COVID-19 services, and other support. Telehealth enables you to meet with your doctor via audio or video conferencing using an iPad, mobile phone, or PC instead of going into the doctor's office. With the event of COVID-19, telehealth shifted from treatment for conditions such as seasonal flu, allergies, ear infections, rashes, pink eye, migraines, and UTIs to becoming the first line of defense for those experiencing fever, sore throat, or difficulty breathing. The doctor evaluated symptoms remotely and determined the best course of action, including a COVID-19 test, while the member avoided exposure to COVID-19 by not venturing out to the doctor's office, urgent care centers, or the ER. While Kaiser's model enables members to connect with their primary care physician, a pre-COVID United Healthcare partnered with Teladoc, Amwell, and Doctors on Demand. These doctors are not the member's primary care physician. In response to COVID-19, United Healthcare expanded telehealth access to include visits with in-network physicians. This expansion ends July 24. Kaiser reports that 75% of care visits are now completed through telehealth. United Healthcare reports that through April 20th, 47% of visits to Teladoc and Doctors on Demand were for respiratory concerns. I would also like to add that under our medical plans, there is no out-of-pocket cost for members for telehealth visits. Member cost share for COVID-19 services. Both United Healthcare and Kaiser Permanente waived member cost sharing for deductibles, co-payments, and co-insurance for COVID-19 testing related visits. This provision ends July 24th for United Healthcare members and December 31st for Kaiser Permanente members. Other support. We are all familiar with curbside pickup of meals from restaurants and from retail stores during this time. Kaiser Permanente was ahead of the curve with curbside pickup of prescription drugs from its facilities. Kaiser Permanente's Washington Health Research conducted the first COVID-19 vaccine trial on March 16, 2020. The vaccine is called mRNA 1273. The mRNA refers to message RNA, think back to your Biology 101 classes, and it's produced by Moderna. The initial trial involved 45 participants and is part of a three-phase process to determine if the vaccine works. On May the 27th, Kaiser announced that Moderna received the green light from the FDA to start phase 2 of the trial, which will include 600 subjects across 10 sites in 8 states. Now for United Healthcare has partnered with Microsoft to roll out a digital platform called Protect Well that includes a COVID-19 symptom checker to help employees decide if it is safe to go to work, manage symptoms at home, or get tested. When released, it will be free to employers. Caremark has 4 initiatives. 1, CVS Caremark waived early refill limits on 30-day prescription maintenance medications, such as those for diabetes, high blood pressure, and high cholesterol. This provision ends June 30th. Number 2, clinical prior authorization approvals set to expire between March 23rd and June 30th were extended for 90 days. This does not apply to controlled substances. 3, To keep members safe at home and limit their exposure to COVID-19, free home delivery of prescription medications is available. This provision ends June 30th. 4, to help slow the spread of COVID-19, CVS Caremark has opened 1,000 drive-through testing sites nationwide. 2 weeks ago, 17 sites opened in Maryland, and last Friday, 39 sites opened in Virginia. There are 3 testing sites in DC. CVS uses self-swab tests, and you do not need a referral from a healthcare provider, but you must pre-register for an appointment. The web address to locate drive-through sites in your area is noted on the slide, as well as the web address for pre-registration. And if you note, even though the URL or the web address for the registration includes the words Minute Clinic, the tests are not available at the Minute Clinic and are conducted outside for drive-through only. Next slide, please. Next slide, please. Next slide, please. Sean, okay, I'm sorry. I'll back up one. Yeah, thank you very much. iMedVision promoted the purchase of glasses and contact lenses online to keep members safe at home. The online vendors are offering free delivery and free returns. iMed, with M-NCPPC's approval, is also offering a discount program called Advantage Cares to any member terminated March 31st through August 31st of this year. There's no cost to M-NCPPC or monthly premium for the ex-member. With Advantage Cares, one can get an eye exam for $50 and substantial price reductions on prescription eyewear at leading retailers and independent optometrists like Lens Crafters, Pearl Vision, and Target Optical, as well as online through glasses.com. This plan is valid through December 31st. Delta Dental their dentists in the Delta Dental Network are following recommendations of the American Dental Association to decrease the risk of transmitting COVID-19 in dental offices. Patients are offered the option to remain in their care or a nearby location instead of a waiting room and receive a phone call or text when it's their turn for treatment. Delta Dental has also purchased 120,000 KN95 masks for network dentists and oral surgeons to ensure the safety of their staff and patients. ICMA-RC, the 457B deferred compensation plan, is used to save funds for retirement. M-NCPPC has opted to allow employees to obtain ICMA-RC's Coronavirus Relief Distribution, CRD for short. Participants are eligible if they meet one of the following criteria. 1, they tested positive for COVID-19, or their spouse or beneficiary has tested positive for COVID-19, or they are experiencing one or more adverse financial consequences, including being quarantined, furloughed, or laid off, having work hours reduced, or being unable to work due to lack of childcare as a result of the COVID-19, or closing or reducing hours of a business that they owned or operated due to COVID-19. Employees may withdraw up to 100% of their balance, not to exceed $100,000. What does an employee need to do to request a CRD? An employee has to sign and submit an affidavit attesting to the fact that they have experienced one of the events noted earlier. Provisions under benefit strategies, our healthcare and dependent care flexible spending account administrator, have changed due to recent IRS regulations. FSA participants can change their contributions during open enrollment or within 45 days of experiencing a qualified life event, such as marriage, divorce, or a newborn child. For dependent care FSAs, a significant change in the cost of child care is also a qualified life event. Participants can now stop, reduce, or increase their contributions through December 31st for any reason. If a participant forfeited 2019 FSA funds, they get a second chance. Participants have through December 31st to incur and file for reimbursement of these funds. Now you have a sense of the measures that have been implemented by M-NCPPC's health and welfare vendors in response to COVID-19. Our vendors have our employees' best interests at heart. We have been keeping our employees informed through a series of updates via email blasts. Thank you very much.
All right, thank you, Cynthia. So again, I just want to echo for everybody else, if you have any questions for Cynthia or for AmberLace to think about what you've seen in the presentation so far, feel free to post some questions in the chat here. If we end up having a little bit extra time at the end, people can stay on past the normal time and we can answer some of those questions. But for the sake of time, we're going to transition into our next and final portion of today's seminar. And that will be with Hassan Symes discussing the preventative measure dashboards that Montgomery Parks has been using.
Thank you, sir. Welcome, everybody. My name is Hassan Symes. I am the EAM GIS manager at Montgomery County Department of Parks. And today's presentation is showing you how data and technology can help assist with this pandemic. So today we're going to be talking about the preventative measures dashboards. Next slide, please. To give you a bit of background information, Montgomery County Department of Parks has 424 parks. There's over 37,000 acres of land that we have, and we have over 16,000 amenities. And when I say amenities, they're playgrounds, basketball courts, and trails. During the COVID pandemic, indoor facilities have been closed, events and programs have been canceled, but our parks and trails have been open for people to enjoy. In order for that to happen, we need to have preventative measures to not allow people to interact too much and to promote as much social distancing as possible. Next slide, please. The purpose of the two dashboards that Christopher Brens and Carter Hughes will be showing you, the purpose was to identify all the different amenities that we have, the 16,000 that we have out there, track all of the amenities that we applied preventative measures on. So we know which ones we have preventive measures on, and once the COVID pandemic is over, we can go back and take those preventive measures off. It also shows a visualization of all the amenities for the operational staff so they can figure out where they need to go to apply those preventative measures. It also helps us to understand the impact of COVID-19 within our department. And it also helps to validate tracking all of the effort that it took for us to apply these preventative measures to allow people to utilize our park system under these circumstances. And finally, one of the things is for documentation for reimbursement, potentially for FEMA reimbursement down the line. Next slide, please. So the four softwares that we utilize is Infor EAM, which stands for Enterprise Asset Management System. It's basically a repository of all of our amenities, and it also creates work orders for operational staff to do their work, so they track their time and labor and material costs in that system. We also utilize ArcGIS Online. That is a mapping software and also does analysis. Microsoft Power BI is a data visualization software, and Kronos is a time keeping system. Next slide. So the workflow for the two dashboards right now, we had the Infor EAM system created amenities lists. that was given to different stakeholders to create a priority list of what needed to have preventative measures taken on. Once that was done, that was given to the operational staff. The operational staff updated the EAM team every day on what preventive measure, what assets or amenities were taking preventative measures on. And then we were able to take that information and create the COVID-19 preventative measures communication amenity dashboard, which Carter Hughes will show you shortly. Once that was done, that was reviewed by the data analysts within the operational team to ensure that work orders were created to make sure that we were tracking all the time and labor for all of those assets. And then once that was done, we created another dashboard for COVID-19 preventative measures, which showed an actual cost of all the work that was being done within the operational staff. Next slide, please. So right now, I'd like to hand it over to Carter Hughes, and he'll show you the amenities dashboard preventative measures.
Okay. Is everyone able to see the screen?
Yes.
Thank you. All right. So what we have here is a collection of preventive measure dashboards that diverge by amenity, from athletic fields all the way to water fountains. The purpose of these dashboards is to track the amenities and their statuses relative to COVID-19. And their statuses are sorted into 3 different groups, as you can see in the legend, with red being preventative measures, yellow being priority for preventative measures, those being amenities that are not yet closed down or taped off, etc., that are identified as a priority, like Hassan mentioned in the workflow, and then ones that have no preventative measures. You can see in the map the dots that are representing each of these amenities via color, and this one specifically is basketball pads. We also have a number of infographics here on the dashboard. The key point being this one here that demonstrates the percentages and counts for each of these different categories. So you can see here that there's 63 basketball pads that have no preventative measures, and then there's also another 5 that are a priority, and then there's 92 that have had preventive measures taken on them. And then over to the right, we have the number of basketball pads via the management areas and regions in which we facilitate their maintenance. These are organized within the 10 management areas that we have in Montgomery Parks, with the sorted by the count here. So you can see this one here, Meadowbrook has 42, Cabin John here has 30, etc. And then following, you can see it by the south and the north, and you can see them highlighting as you go over the infographics. Additionally, we also have incorporated the Johns Hopkins data source, where you can see the confirmed cases for the county and the deaths, if you wish. And perhaps the second most important feature is this filter widgets right here, where you can toggle these to exclusively see the amenities that have that certain status. So say we want to see the ones that are only preventative measures, we would toggle this. The map would then reflect only basketball pads in this case that are having preventive measures taken. And then the infographics will also change. As you can see here, the donut is 100% red, and then it has a different varied counts with the preventive measures for each management area and for each region. You can see it there change. Likewise for each of these other toggle filters here. Furthermore, if you want to get really specific, you can take it along and even export these locations into Google Maps for navigation. So for like this example, you would identify a basketball pad that's priority. You can click on it here and then export that location to Google and directly get those directions that you may need to get there. For the most part, all of these dashboards have the same look and feel for each of these amenities. The only one that has any difference is road closures. These are roads that Montgomery Parks has closed down for which they manage that run along our trails to facilitate further social distancing and space for that social distancing. And you can see in red the portions of the roads that are closed on weekends. And you can see here in the list, which you can click on and have the map focus in on each of these sections. And you have some other useful information incorporated in this dashboard also, where you can see the total closed miles by each road, which are Beach Drive, Little Falls, and Sligo Creek. And then just for boot, you can see the closed miles by management region so that they know what is going on in their own maintenance areas. And that is all. You can take the controls, Chris.
Thank you, Carter. Hello, everybody. So I'm going to be sharing my screen right now on the dashboard for Power BI. So on this main screen here, this is focusing on EAM, which Hassan explained to you, which is our enterprise asset management system. So on this dashboard, everything that was entered by our staff and teams at our different divisions using the activity code 90301, which is basically our COVID-19 code. So all work orders associated with this code is being tracked. So here we have a high-level view basically of everything from the inception of the pandemic, starting from the end of February, going to obviously now to beginning of June. So right now we are at 364,000 labor costs, 200,000 in materials costs, and about a little over $500,000 in total cost combined, and 11,000 hours and 125 on total labor hours spent on COVID-19 prevention efforts. And just like Carter's dashboard, everything is interactive, and we can go into specific areas and even time frames that we want to look at. So for instance, if we wanted to look at a specific building or park, we can go down here in this drop-down menu and look at a specific park. For instance, let's look at Black Hill Regional. If we click on that, we can see the location here on the bottom right-hand corner on the map, and then we can see all of the costs associated on the top here, and then the work orders that have been completed basically on working on this one single park. And if we uncheck it, we will go all the way back out to the higher level view, and we can also filter the information by a specific asset. So whether that's a basketball court, playgrounds, or general maintenance, which is here, we can see all of those areas here on the map as well. And looking on the bottom left-hand corner here, this is all of the labor hours associated by park and buildings. So on the top here, we have the most amount of hours, which is our park police headquarters, which is at 1,027. And as it goes down, obviously it's going to go smaller and smaller. And on the right-hand side of this graphic, we have the labor costs broken up by division. We have three main divisions that utilize EM the most, which is our Northern, Southern, and Facilities Management, which is color-coded here. Facilities Management is that darker blue. We have the yellow color for Northern and the Southern for that lighter blue color. And we can highlight over each color and see the labor costs associated
which each division, as we can see, Southern is the most, using up the most of those labor costs. And we can even go down and see a month breakdown of since the beginning of the pandemic. And on top of that, we can even filter by a specific area. So obviously we have different teams and different divisions, and they're responsible for different areas, especially we have such a large, diverse parks. So here in the map, this is all integrated back to GIS, and we can see all of the dots here. Basically, all of these dots represent obviously a location of a park or a maintenance yard, and the bigger size of the circle, basically the more cost associated with that location. So for instance, if we wanted to see a specific area, so up here on the middle, we have these blocks and we can click on Meadowbrook. And here we can see that specific area and then all of the work orders here associated with those locations in that management area. And then obviously in the top here, we get a full breakdown of the amount of hours, costs, and total costs. And then here we have on the left here, all of those locations and their hours, their labor hours that have been dedicated. And we can also, as I said before, we can also filter down by a date range. So if we wanted to look at the beginning of March till the end of March, we can also do that as well. And we can also filter down just that specific time range if we needed to. And the next page that we have in this dashboard is going to be our Chronos hours. So these Chronos hours is very similar to an EAM where we were using that same code, which is 90301. Everybody in Chronos who is inputting those hours using that code, we're able to track it and get that information from our CAS. So here we have total, it's a little bit behind because we do have to wait for the pay period to close. So as of 5/16, we had a little over 20,000 Chronos hours that have been entered for COVID-19, whether that be administration or leaders and managers. And we can also see that broken down here by division, even the date ranges here. We can see March, April, May. And we can see those spikes on each of those divisions. For instance, we can see in April, we have Southern Park Division here, which is the highest amount, and we can click on that specific division, and we can see here 1,545, and back in March as well, and also in the beginning of May, for a total of 3,713 hours. And here in the bottom here, we can also see the percentage of pay grades of those, basically percentage of hours per pay grade. So we can see the amount of employees that are utilizing the most amount of hours dedicated to COVID-19. So this dashboard has been really helpful for managers, leaders, and it's allowing them to really filter in and hone in on specific data and be able to make decisions, whether it's staffing, obviously budgeting, forecasting, and making those decisions, and hopefully being able to make better decisions for the next fiscal budget year. So that's all I have, and I appreciate your time, and I hope you're all staying healthy and safe. I will pass it back to Hassan.
Thank you, guys. I believe that is all we have. Hello?
Excellent. Well, thank you, guys. Sorry, I realized I wasn't unmuted there for a moment.
Oh, no worries.
We did see some questions come in there after probably through part of Chris's presentation.
Did we get approved for moving vans tomorrow?
We have somebody, I think we might need to be making sure we're muting all of our microphones in the audience. But for Hassan and the rest of your team, we had a question from Janetha asking if the costs were estimated or actual. And if it's actual, how is it reconciled with the financial statements?
Yeah, so it's not actuals. They're actually a blended rate that's put together by our budget, I guess, Nancy Steen. I believe she's the budget manager for Montgomery Parks.
Okay, excellent. And then the question was asked about whether the labor included park police and non-full-time employees, but it looks like then Chris was able to answer that in his presentation on the fly. We do have a little bit more time, so I had another question that kind of just came to mind while I was listening. It's for you, Hassan. So for some of the agencies out there who may not be as large as Montgomery Parks or as the commission, and they don't have this access to these systems like EAM and different things like that, where would you recommend that they start if they see something like this and they want to start working towards tracking a little bit more data?
So first, I would definitely look within your organization and see fellow coworkers who are data-driven, such as yourself, and try to figure out if you don't have any high-powered systems as of yet. I'm pretty sure you may have Excel, and then just start with maybe one type of amenity or asset, and then do a proof of concept, and then go from there.
Yeah, also to elaborate a little more on what Hassan's saying, the most important thing is obviously having that foundation and that accurate data sets. You know, getting people involved, your teams, your managers, staff members, the more people you have, you know, willing to really build this data set and really understand the importance of accurate and reliable data is really going to help you in the long run. So I think that's definitely the first step, is get as many people on board as possible.
Excellent, thank you all. And then one last question that came in a little bit earlier on was, is this available for Prince George's County as well? Or has there been any talks about integrating Prince George's County along with the dashboards?
Yes, so currently right now, Prince George's County does have an EAM system, but they do not have the dashboard portion as of yet. But we are definitely working towards getting them into that realm.
Excellent, thank you.
Sean, I just had
Yes,
one
Adrian.
thing. It's Adrian. I just wanted to say that AmberLace was able to share her links for the self-care mobile apps she talked about, and they are in the chat. And those will also be posted on the MRPA website along with the slides, and eventually the recording will be posted on our YouTube channel, but that does take a little while. But the slides should go up sometime later this week.
Okay, thank you. All right, well, I think that brings us to just about the end of today's session. You're welcome to stay on with us if you have some more questions and you'd like to put them in the chat box. But at this point, we can consider the session adjourned. If you look on the screen, you'll see some of the social media links for MRPA, as well as our website in the bottom right-hand corner of the page. On our social medias, immediately following this session, we're going to have some posts that are going to go up that are going to keep this conversation going. So if you have something that comes to mind in the next day or so, or if there was an idea that you didn't get to share or a question you didn't get to ask, we'd love it if you'd go over to any of those social media pages and engage with us, take a look at the posts that go up, and feel free to start the conversation. So with that being said, thanks everybody for attending. I want to say thank you to our panelists especially as well. And everyone, try to stay safe out there and have a great rest of your day.